Doctors of Reddit, what's your thank god they came in for a second opinion moment? A nurse here. Had a lady in for simple pneumonia. Her 13-year-old son was getting bored, so I showed him some equipment. I connected a simple heart monitor to him and discovered he was in a complete heart block. I printed a strip and showed it to the document. We suddenly and unexpectedly got a cardiac patient. I had a guy come in for a second opinion after the first place didn't bother asking any medical history. Of course I took his history and asked more questions as we went. I remember telling him something felt off and we needed to run a test. So I ordered a peripheral vision test. When I got the test back I was shocked by the most classic tumor pattern I'd ever seen. 2 weeks later he was in surgery to get it removed. A month after this guy was back in my clinic thanking me. Totally different guy. Personality was a complete 180. Energetic and happy. Edit. Here's another one I thought of though a bit more sad. But also good at the same time. Here's a cautionary tale why urgent cares should never treat eye issues. Lady was referred to me after 2 weeks of treated for a red painful eye. The PA and MDs that saw her tried allergy meds and antibiotics thinking it was allergic or bacterial conjunctivitis, or hoping it was mild viral that would resolve on its own. So I took one look at her and knew it was a herpes simplex infection in her cornea. She was in pain and had been mistreated for 2 weeks. Got her on antivirals, but after discussing how it was odd she didn't have any active herpetic sores, but had a really bad cough, that the said was just pneumonia, and would go away with antibiotics. I told her to get it checked with a pulmonologist, because it didn't sound like pneumonia and it wasn't getting better. I saw her 3 months later, to monitor her corneal appearance and she came in using a wheelchair. Turns out the pulmonologist was blown away that the had dismissed her. She had a really rare small cell lung cancer. The reason the herpes infection manifested in the first place was her immune system was compromised. She told me the pulmonologist said it saved her life because they caught it early. It's been a bit over a year. She's still undergoing treatment, but her spirits are strong and she's optimistic as is the pulmonologist. 22-year-old guy came in after seeing his primary at another hospital. His mom was my patient and asked if I would see him. I'm an internal med doc. He had told his doctor he had a headache. I did a usual full review of symptoms since he was new, and he also marked his left testicle had a lump. Did examine he had hard small lump on testicle. Knew right away likely had metastatic testicular cancer. One stat brain scan and testicular ultrasound later confirmed it. Asked him if told other doctor about the lump, and he said yes, but the other doctor told him it was normal. Edit. He lived by the way, but it was close a few times. So fellows, if you note a lump on your testicle, ask for an ultrasound and don't be embarrassed to bring it up. Edit 2. For those of you who are concerned after examining yourself, there is a small soft area posteriorly that should be similar on both your testicles known as the epididymis. That is normal. A hard lump on only one side only is not. Monthly self-checks between ages 15 to 34 can be done, but since rare, 0.000, not a general recommendation. Oh god, where to start? I literally just admitted this lady to IQ, had been coughing for ages, 60-pound weight loss, smoker for 50 years. Now she can't breathe, and I got a CT 6 cm mass looks very suspicious for lung cancer. And the doctors for 4 years throughout this just gave her vitamin D/E, even though she was losing massive weight and coughing up blood. Another guy who came in looked pale as a ghost. Chief complaint was fatigue. One lab test later found out his hemoglobin was 4, barely on the cusp of survival. Seems like he had iron deficiency anemia for years. Doctor gave him some iron. He got better, but no one looked into why he got it. Number 1, 2, 3 reason in an older guy's colon cancer. He died 4 months later from metastatic colon cancer. Another story last month was about to take a long trip across the Pacific. 1 hour in on the flight they ask for a doctor. I volunteer myself. I see this lady literally gasping for air, like waving her hands in the air cause she can't breathe. Look through the meds, she's obviously an asthmatic. Listen to her lungs and faint wheezing, no air movement at all. I later grounded that plane, because there was another 16 hours to go, and she was on verge of being intubated. Later I get more story from family member. Apparently she wasn't been able to sleep well for past 2 weeks. Doctor just gave her sleeping meds, more and more of it. Told her flying no problem. I ask the family why can't she sleep? Is it because she wakes up in the middle of the night gasping for air? Classic sign of uncontrolled asthma. They're like, yes, how did you know? Sleeping meds prob among worst things she could have gotten, and almost killed a patient by saying she could fly. People who get diagnosed with bronchitis when they have heart failure and literally drowning in fluid. There are doctors who give antibiotics and steroids for everything ESP when they have no idea what's going on. Maybe I'm biased because I work at an academic center, so I see all the cases who get referred in because they're too sick or no one can figure out, but at least a few times a week I'm like, wow, this person could have been saved or not end up this way if someone cared enough earlier on. I'm going to say this as a doctor. It's honestly scary every day how many patients I see are completely mismanaged. Some doctors in urgent care see like 45 patients in a day. How is that possible to be thorough? Like if only patients knew what the doctors missed or whatnot. Half the time I really think it's like going to an bad auto shop and not realizing they are just making half the shit up. Same thing happens in medicine, and except people's lives suffer because of it. Edit added a story. Thank you to whoever gave me silver/gold. Let me say something. People are saying I'm Gregory House or something. I'm not. I purposely didn't choose stories that were some esoteric diagnosis. Everything I picked is like bread and butter medical student level. Half of being a good doctor is knowing what questions to ask. Sometimes you don't even know what's important or not. The other half is caring. Too many just put a band-aid on the problem and punt the patient to someone else. Is it the doctor's fault? I don't know, but I do know the medical system in the US provides no incentives for doctors to actually practice good medicine. In fact, I bring in less money if I'm thorough versus I do the same thing every patient and see 100 patients a day, which is what some do unfortunately. I have tons more stories. Hopefully I'll get to share some more, but for now have to sleep. Was on call overnight. Edit X2. Thank you again for all the guilds. I don't even know what they all do or mean, but I'm very grateful nonetheless. Few more things I wanted to say. There are plenty of amazing doctors out there. Not all are bad. We all put our lives on hold for 10 years for altruistic purposes. Not everyone just wants to make a quick buck, so I hope I didn't characterize it as such. I tried to respond to some comments, but I don't have time to respond to all. A lot asked, so how do I find a good doctor? The answer is, I don't know. I've tried looking for good ones myself and it's hard. I joke you should find the doctors all the other doctors go to because I have a higher BS meter when I meet a bad one. Doctor rating websites are garbage. I've seen doctors get great ratings because they just hand out opioid/benzodiazepines to everyone even if all his or her patients become addicted later. A lot of it is really your gut feeling. A good one should listen to you and most importantly, sometimes be confident enough to say I don't know, but I'll look it up, or send you to someone who does know. The scariest ones are those who don't even realize what they don't know. And the most perplexing thing to me, if you don't like an auto mechanic or realtor, you would find another right. Do the same for doctors. It's your life. Can be a difference between living or dying one day. Go find someone who will advocate for you. It's the least you can do for yourself. I can't count how many I was told it was a headache, but I just wanted to come in and have it looked at in case it was something else as I've seen. Of course, those are the patients that are the nicest and are profusely apologizing for wasting our time, and of course, those are the patients that have a brain tumor show up on their court scans. Edit. Well, this blew up. Big apologies to everyone, but I'm not a doctor. I work in the hospital alongside other doctors and I get the chance to see everyone they see. Apologies if I misled. That was not my intention, and I will make sure to be clearer next time. I'm an emergency medicine doc in the Midwest USA. The patient was transferred from rural nowhere to our tertiary care facility, big hospital with every specialist. Call was of really bad quality, but the transferring physician described a 21-year-old male that had rapid heart rate and breathing rate, low blood pressure, low oxygen, confusion, and a severe opacification on his chest X-ray on the right side. Diagnosed pneumonia. He gave him a ton of fluids, started antibiotics, put him on a ventilator, but he wasn't getting better and wanted to send him to us. Sure, send away. An hour later the gentleman arrives and looks young, fit, and not the type to just drop dead from pneumonia. We roll him onto our stretcher and find a huge stab wound in his back. The X-ray finding was his entire right chest full of blood. We put a tube in it, gave him back some blood, and he had to go for surgery to fix the bleeding. Lesson: look at your patient. Eye doctor here. I had a patient I saw several months before they came in for their visit, but well less than a year, which often means something could be wrong. In this case, as it turns out, nothing was wrong with her by way of complaints. She just wanted to get updated before getting some new glasses. We decided to just run the regular gamut of tests anyway, just because we might as well. While she was there, she was a 50-year woman, fairly normal exam, perfect vision, retinas showed healthy, but something about her pupils really bothered me before I dilated. We chatted about it, and I asked her if she banged her head or anything weird, and she said no, but suddenly reveals this crazy history of an old meningioma, a type of tumorous brain growth she had removed a few years ago. She had decided to omit this from her history with us as she didn't feel it was important, but we went and put it into the charts anyway. Turns out she got a caught done 2 weeks prior to her exam with me, which she says turns up completely normal. I tell her she should tell her doctor about this anyway just to cover our bases. Fast forward, patient shows up in my office ecstatic to tell me that my examination revealed that her tumor had returned with an incredible vengeance. She had no idea, was totally asymptomatic, and the caught she had prior to me showed what was very literally the size of a speck of dust, which the radiologist dismissed as artifact. On her return to her doctor, they decided to rerun the caught to cover their bases, and they found a quarter-sized tumor. Within 2 weeks the tumor went from the size of a dust particle to a quarter. She was rushed into emergency surgery as the tumor was growing super fast, and was close to a blood vessel which could cause a massive stroke. She had it removed that day, and returned to me after recovery, to tell me of what got discovered as a result of my testing. She is now a long-time regular patient I have been seeing for about 10 years. Had a patient come in for therapy after his PCM yelled at him for being a hypochondriac, and saying his symptoms were all in his head, and that he was just trying to fish for disability. His symptoms were pretty obviously neurological, so I referred him for an MRI. To my shock, he had only ever had x-rays. Sadly, I had to tell the 19-year-old man that he had multiple sclerosis. With great satisfaction I got to tell that PCM he done goofed, and that I would be talking to our mutual chief of clinical services about the incident. Can I go ahead and speak on behalf of my doctor? 19 meters at the time, 33 now. I felt sick for about a week, flu-like symptoms, didn't want to eat, just felt bad all over. One day at work I feel a very uncomfortable cramp/tear in my abdomen, so I go to one of those 24-hour clinics. At this point I'm slumped over, can't stand up straight without insane amount of pain, just generally uncomfortable and hating life. After a few hours at this clinic, they say you probably have kidney stones, go home, drink fluids, sleep it off. This seemed fine to me. I was ready to go home and listen to the doc, all was good. But my girlfriend at the time didn't last much longer than that, wasn't a fan of this diagnosis and drove me to the ER, against my wishes of course. After a few minutes at the ER, they determine my appendix has ruptured and I'm going septic. Apparently I was pretty lucky to not have died, though I did pick up bacterial pneumonia while in the hospital, so the recovery kinda sucked. Now I just have a crazy 6 to 7 inch scar on my belly to remind me to not avoid hospitals when I'm sick. I'm not a doctor, but I'm glad my parents took me in for a second opinion when I was complaining about a bad headache when I was 15 years old. I left school one day and went to the hospital for a bad headache. The doctor said it's just a virus and that I should just rest and take meds. I went home, laid down and took some Advil and carried on with my night. Around 1 AM, I was screaming on the floor. My parents took me to a different hospital and they ran tests and eventually did a spinal tap and discovered a ton of white blood cells. Turns out I had bacterial meningitis. not a doctor, but I heard my son's doctor say this. I took him to the ER late one night because of coughing and a high fever. They took an x-ray, gave him ibuprofen, and told us he was fine. Doctor showed me the x-rays to prove it, and gave me a dirty look. When I asked what the dark spots were, I told her she was an idiot and took him to urgent care 4 hours later. The doctor that saw him immediately diagnosed him with pneumonia, and confirmed with x-rays. I flat out refused to pay for the ER visit, and told them that, if they persisted with collections I would push their incompetence. They never called me again. Dermatologist here. I have seen probably 5 instances of my other doctor told me it was fine that were melanimous. A lot of times people don't want a full skin exams. There are lots of perfectly sane reasons for this. Time, perceived cost, history of personal trauma. However, I routinely find cancers people don't know they have. Keep this in mind. If you see a dermatologist for acne and they recommend you get in a gown,